This is a CJASON podcast, and I am Barrett from the Durham Veterans Affairs Medical Center in Duke University. On behalf of my co-authors, I'm excited to have the opportunity to discuss our manuscript, Older Patients' Perspectives on Managing Complexity in CKD Self-Management. This work was funded by Veterans Affairs Career Development Award. As CJASON readers know, patients with moderate to severe CKD are asked to perform self-management tasks. In our geriatric renal clinic, it's often said that patients with advanced kidney disease leave clinic with 5 new instructions. Take a new medication or a new dose of an old medication, avoid an over-the-counter medicine, make a change in their diet, monitor one of their other conditions like hypertension or diabetes, come back if they develop symptoms that might signal worsening kidney failure. There are some reports of the challenges faced by patients with CKD to self-manage their health. This may be especially difficult for older adults with lower functional capacity. However, we don't know much about the specific challenges faced by older adults with CKD in initiating and maintaining self-management regimens in the context of their daily lives. To address this knowledge gap, we conducted an exploratory study to understand the relationship among factors that facilitate or impede CKD self-management in older adults. We conducted focus groups of CKD patients 70 years and older at the Atlanta VA who had at least one eGFR less than 45 in the last year. The central organizing theme that emerged from these data was that older adults face considerable complexity when self-managing CKD. Their ability to follow management recommendations is influenced by their health conditions, including the other multiple chronic conditions they have, by personal factors such as their own capacity to plan and organize, and by environmental factors, including good coordination of care across multiple providers. Participants gave examples of how they try to negotiate complexity across multiple conditions, often receiving conflicting or discordant recommendations from providers. They also reported strategies they use to manage complexity, including prioritization. For example, some participants said they chose to focus on their blood pressure when given multiple recommendations because they understood it to be an underlying causal factor for CKD. Some participants suggested that better coordination between specialist and primary care physicians could be helpful for reconciling conflicting recommendations and individualizing care for patients for what one participant appropriately described as all having multiple problems. While it may not seem surprising that older CKD patients have multiple chronic conditions, hearing the specific challenges that patients face and their approaches to dealing with this complexity in their own words is very powerful. Although for older adults, CKD almost universally occurs in those with multimorbidity, routine clinical care follows a one-condition-at-a-time approach that leaves integration of recommendations across conditions up to patients. An integrated treatment approach that supports self-management across commonly co-occurring conditions may be necessary to meet the needs of these patients. Thank you for listening.
This podcast is copyrighted by the American Society of Nephrology, all rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare provider if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast of the American Society of Nephrology.